This morning's summit started in a very interesting and engaging way. The key takeaway for me was to reinforce this notion that we need much better knowledge base out there, and a knowledge base that both professionals can use and also communities can use in order to allow services to improve in a way that meets patients' needs. And it's not just enough to have the knowledge out there, but we need to help people access it, to interpret it, and to be able to integrate it into how they approach their lives. So what I saw was this sense of a democratization of the knowledge about health services, where we can bring, if you like, clinical experts and communities together to think about service improvement and also some competitive benchmarking across different areas in the country or different models. UCL Partners is trying to connect a large academic and clinical community to a set of communities in north central London, and a lot of our work is actually quite small scale, despite the fact that the names in our partnership are very big. So for example, we're doing a piece of work with pregnant women, where we're bringing a whole set of strands of academics, not just obstetricians, but also people involved in geographic mapping, urban design and planning, and information technology and psychologists to help empower mothers to navigate their way through their pregnancy. And what we hope that that'll do is to reduce unnecessary visits, to improve mothers' sense of control over their pregnancy, and make the service more responsive to those patient needs. We have allowed the NHS to be quite paternalistic, so the public are quite passive and the professions are quite dominant. And I think we can see increasing examples of where professionals and communities and families are coming together around a shared agenda that meets patient needs. So I'm quite optimistic about this. Another example of what we're doing at UCL Partners is a project in adolescent diabetes, which is basically taking customer relationship management principles for industry and applying them to patients and their clinicians. So we call it patient relationship management, and you give people smartphones in order to help them create a social network to communicate with their health provider, book their own appointments, that sort of thing. The sort of thing in healthcare that today seems quite radical. I hope in a year or two it'll seem less radical and it's becoming commonplace in other walks of life.